and welcome to another edition of the Nation Weekly Roundup. I'm Pasha Rahim. As usual in this edition, it will be a roller coaster of ideas and perspectives as we delve into various local and global issues that have been making waves throughout the week or important issues that need to be highlighted. Today in studio, I'm joined by HETAL DOSHI, the Organisational Psychologist and CEO of Psych Sendirian Berhad, and also joining us virtually from Balik, Pulau, Penang is Dr. FARIDHIL ATHRASH SALLEHAN, Medical Officer in charge for mental health from Putih Health Clinic. Welcome, Dr. ATHRASH, and also HETAL in studio with me. How are you doing today?
Really good. Thank you so much for having me.
All right. We've got a few different topics that we are going to hopefully sail through today. But first of all, let's talk about these designated smoking areas. Now, there are a few articles that I came across recently about designated smoking areas. Now, as we all know, the government has introduced a no smoking policy, especially in areas where, in restaurants and eateries and other areas, other public areas. However, recently, Health Minister Datuk Sri Zulkifli Ahmad said his ministry is considering the introduction of DSA or designated smoking areas for smokers near food premises that are located close to each other. So we're talking, food stalls or areas such as Jalan Alo, if you're familiar. So all of these food stalls are placed very closely together. And if we remember clearly, we're not allowed to smoke within a 3-meter radius of these food premises. However, if all of these food stalls are placed very closely together, then these smokers would then need to go quite a distance away in order for them to be able to indulge in their nicotine habit. He also added that these dedicated spaces would consider the needs of both smokers and non-smokers, and the initiative is not a step backwards, but a proactive measure to ensure a harmonious environment for everyone in the area. Now, if we also notice in areas such as airports or in hospitals, there are already existing designated smoking areas where people would have to go to a smoking room, for example, and often these smokers would not go because it would be placed at probably the far end of the building, and then in the end what happens is they're discouraged. They're like, you know what, I'm not fast, I can't be bothered to go that far. Just to hear what your thoughts are on this. Do you think it is a U-turn by the government on the non-smoking policy, or what is it?
Well, definitely not a U-turn. I think the ultimate aim is higher levels of consciousness as we progress as humanity, right?
Yeah.
Just as you have places in your own home for peeing or eating or for sleeping, we live in a space outside of our home. And obviously, whenever you're having certain types of activities, it would be very helpful to contain it in certain areas as well. So that's one thing. I think it's helping to elevate us to move towards a higher level of consciousness. That's number one. Number two, when you talk about the ultimate thing that people want is freedom. We all want to have, ultimately in our life, loads of freedom in our life. But in order to get freedom, discipline is very critical.
Yes.
Right. So the more disciplined we are, the better our lives will be eventually as well. And it's a pretty good habit as well. So I think it is, I think it's a natural progression going forward. And for those smokers who feel that it's a bit too far, then that's good. That's also good to maybe, lessen the number of...
Yeah, because at the end of the day, it's a bad habit, and we want a healthier nation. It's a smoking habit that needs to be cut, right?
Yeah, I would just like to add one last thing. I think it's also very important not to stigmatize smokers or people who choose those habits, because I think all of us have different habits that are not very good. And I think to have a whole judgment on a person is not very helpful.
Fair enough. Like you said, we all want choices, but with those choices also come, responsibility. Dr. ATHRASH, your input on this issue.
I agree with HETAL because discipline is important. In order for us to have prevention of illness, we need to have better discipline compared to we just simply mix rules. People won't listen. People will comply if we give them public area, for example, designated smoking place. Okay?
Right, okay. So talking about, being able to have choices in our lives, now I think this also directly relates to a person's well-being, when we make choices for ourselves, we often think about what's good for us.
Yeah.
And I think it's something that you have to talk about, HETAL.
Yeah, well-being is a very natural part of actually figuring out how we're going to thrive in our life from a performance perspective, and organizations that we work with because my background is in organizational psychology, everybody wants to be successful. But when we talk about mental health in not only Malaysia, globally, we always talk about mental illness. So unfortunately right now in Malaysia and beyond, whenever we talk about mental health, we're talking about depression, anxiety, stress and suicide. And there's really very little value assessing yourself on those domains instead of assessing yourself very holistically. So for example, when Malaysia started rolling out the DAS, which is depression, anxiety, stress and so on and so forth, what started happening was people started looking at themselves as clinical issues. And you started finding, in fact, the two of us, between the three of us, we would have some level of depression, anxiety, etc. We would.
True.
But that's not the goal. No matter how poorly we're doing in life, the goal is how well we are. So the measurement that we have created now is, instead of mental illness, let's talk about mental health holistically. How well are we doing? The second thing would be that people will say sometimes, hey, it's not my fault. Because of you, I'm going through drama in my life. And typically that could be organizations. So we have the responsibility of the organization, which is called psychosocial risk. How much of drama do you put me through?
Right.
And then when companies assess themselves on that, now they can also take responsibility for what they might be doing. Then lastly, the organization could say, actually, maybe we are not the drama, maybe you are the drama, and there should be a space for two people to talk to each other, and that's called psychological safety.
Right.
So the measurement that we have in place, I mean, what gets measured gets done. But I think the way that we're measuring well-being is wrong, and it doesn't really help us to understand who is responsible for what areas. So for example, psychosocial risk or the drama could be the organization. Well-being is my responsibility and safety is our responsibility.
Dr. ATHRASH, what do you have to say about the general well-being of Malaysians in this country? Are we okay as a nation?
I think, yes, we need to address regarding the mental health holistically. Because why? For example, a lot of people, they bring up this issue. They think that it's only clinical. Yes, what HETAL said is a psychosocial problem because it's regarding our life, our job, our school, our environment, all the interpersonal relationship. So I think, yes, it's very important for us to have a very decent lifestyle and also very improve index of well-being in Malaysia, so that we can improve our lifestyle and our happiness.
But ultimately, right, when we're talking about the well-being, the general well-being of anyone in this country, who is responsible? Are we responsible for ourselves? Is the government responsible for the well-being of their people? Are companies or organizations responsible for the well-being of their staff?
I love that question so much. The question can be answered very simply by asking another question: who would you leave your money with? I think when you talk about your money and your mind, keep that with yourself and take full responsibility of it, because nobody, including your parents, could do anything to help you except for yourself.
Right. Dr. ATHRASH, anything you would like to add on to that? Who's ultimately, the question was, who is responsible for, one's well-being?
It's your body, it's your life. So it's your own choice. So you need to take control of yourself, not anybody else, including your family.
And what are some of the things that we can do, to we talk about this all the time, right? How do you take care of yourself? You need to look after yourself. You need to look after yourself better. You need to you do all of this. So what is it exactly?
So what? Okay, so I think just extending on that, although you are the primary caretaker, there could be a lot of other elements in play that could really help you, because a lot of times people say, oh, it's your mind, you take care of it. But the environment that we are in plays up to about 80%, like a plant, right? It can do as much as it wants, but if it's placed in the better environment, it thrives very naturally. So there are things that the government can do, that we're working with the government, we're working with media parties, working with university, we're working with associations and corporates. So at every level, everybody can do something within their power to elevate it. So from a well-being perspective as an individual, what is the first thing that I can do for myself? I would definitely say, from all the research that we've done, practically observing people, the first thing you can do is take care of your breath. Because that's the first thing you're born with, and that's the last thing that you will have before you die.
Right.
So if you can just learn how to breathe with yourself, I love that you're already like, oh yeah, I do have something called my breath.
Yes, that's right. And sometimes you don't realize that. You need to remind yourself, oh, hold on, I need to take a breath.
Correct.
I do need to take a breath.
70% of our body is water. So it's like an ocean of emotion. So one of the most valuable things to do, and I just spent close to about 10 days in Rishikesh, part of India, just learning what are the different techniques. And literally, if you just learn how to work with your breath, obviously there are many other things as well. But yeah, one of the easiest way to start is to work with yourself, your breath.
All right. Speaking about, taking care of ourselves and, taking a minute to take a breath, a lot of people, when we talk about looking after ourselves now, I think we look towards supplements and vitamins and, traditional health products, etc. And I think Dr. ATHRASH has something to say about this.
Okay, so it's very important regarding medication, regarding supplement, regarding herbal medication. Doctor, pharmacists, nutrition are not allowed to promote in social media or publicly. Why? This is because our job, our work scope, so we cannot conflict with our interests. So we have to treat our patient holistically and also due to the what sign and symptom they came with. So we cannot treat them to promote medication. For example, oh, you have flu, you have cough, so you need to buy vitamin C, buy this product, buy this brand because it's very good for you. You can buy it from our clinic because if you take this, you take 2 bottles, we can give you discount. Cannot, because this is their right. They need to choose their own medication or, for example, supplement or herbal medication. Herbal medication is strictly prohibited if it is not undergo thorough research. So means they need to have animal or human trial before we can consume the medication. So very careful to all doctors, pharmacy or nutrition or anybody out there selling products, you are being watched by Kementerian Kesihatan Malaysia. Be careful.
All eyes are on doctors, especially now that there's a lot of presence on social media as well. And sometimes I think at the end of the day, they don't realize that they're doing something that's against the law. Maybe to them, they're just supplementing their income. Dr. HETAL, your thoughts on this?
I will stay away from medical stuff because I'm not a medical practitioner. But I think there is a space between doctors and psychologists and beyond, and that's called your collective intelligence. There are many people who've gone through many different things and they might know a lot better than professionals like myself or any other doctor, right? And these ideas can be compounded, and I think there's a huge space to learn, and there is no one path to being able to get to the ultimate outcome, which is your well-being. Right? So I think what companies have started doing is that they are offering psychologists, so for you to be able to have conversations so that you can get well. But there are so many other avenues that you could go to that might not be completely certified but have a great experience that help you to get to the outcome. So I think there's a whole shared experience that is well above and beyond what maybe medical practitioners or science knows about today. That could be helpful, and if enough people feel that it's good, maybe you want to try it, then I think that's your body.
Your body, your choice.
I suppose.
Right. Dr. ATHRASH, I just have one question for you. We see a lot of doctors these days, especially those who are on social media, they're promoting not necessarily products, but they're promoting their services. And one very, very prominent, I would say, treatment that they are selling or putting out there is bariatric surgery, or, one of those balloon they inflate a balloon in your stomach, and often we're seeing them promoting these treatments to people who don't physically present as requiring these medical interventions. I would like to know what you think about this.
Okay, so this is also not allowed in Malaysia. Because why? We cannot promote our service. We cannot promote the kind of treatment to the patient. Because why? As we all said, we have a tight, we call it SOP. type procedure we need to follow in order for the person to undergo a bariatric surgery or intragastric balloon, because we need an indication so that we can do the procedures. It's not if you have money you can do the procedure. It is wrong. It's against the doctor's oath that we're all taking, and based on MMC professional conduct is already stated there that doctors cannot promote their service inside the brochure or inside the television or social media.
Okay, so that pretty much clears it up. So I think if there's anything that we see online, I think we should be able to report this to the authorities. Moving on. Whenever we talk about mental health care and treatment, or the barrier to seeking treatment is always the ease of access. And I think while it has gotten better, there are certain challenges to getting access to that healthcare. Recently, though, the Human Resources Minister, Stephen Sim, had announced that the National Institute for Occupational Safety and Health has allocated an amount of 12 million ringgit to provide training for 10,000 workers through the Occupational Mental Health First Aid Program this year. And he said that the program will be introduced for the first time with support from the National Centre of Excellence for Mental Health. And this is aimed to train people with the ability to provide early intervention, particularly in the workplace, for colleagues facing mental health issues. And I think this is an area that you are working in as well. How do you see this announcement or this effort coming from the minister?
I'd like to start with what you were saying earlier with regards to access, right? So we were talking about, I think there is a statistic of depleted resources of mental health care for people who might need it in Malaysia. But here's another interesting thing that I found out, that even when you are provided, like a company provides dedicated psychologists, the take-up rate is only about 2%. And I don't think it's a stigma issue. I think it is a different type of issue, which is, I'm not sure how many people love going to the doctor or love going to the dentist or love going to a psychologist.
I love going to the dentist.
You love going to the dentist?
I do, actually.
Okay, so I'm not sure how many. I'm sure there are some who are doing it really well. Like, I love going for my full body medical, but I think there are some who would resist it, and it's subconscious. But what is happening over here is that there would be but what we like to do as human beings, instead of going to a professional, is talking about it to a person next to us, like, hey, I think my kidney are very pain these days, or my in-laws are causing a lot of issues. So it could be mental health related issues, physical health related issues. But the people that we like to talk about it to is the person probably sitting next to us or we feel closest to. So what I like about what the ministry has done is that they're offering this skill to be something that everybody and anyone can hone, so that when a person talks to you about it, and it's very likely that they would talk to you sitting next to you rather than going directly to a doctor, even if it is a heart issue or whatever not. And then the other person is skilled to be able to have that conversation such that it eases the person's burden straight away, rather than increasing it, and the person feels, I was worth it having a chat with my friend, rather than it was really not worth it having that chat. So while I think it's valuable, I think one of the other things that is very critical in an organization is, before we get to the point, how do we mitigate so that people don't go into that area? I think the other concern that I typically would have is that instead of clinical related issues or mental illness related issues, why are we also not considering inventing or skill development on well-being promotion? So what are the ways that we can get well? Otherwise, we might be promoting more and more chat about, I've got this problem and that problem and all.
Though I see, the benefits of having colleagues who are trained to pick up on early signs of mental health issues, etc. I feel like that it could be a problem also when, like you said, we are more inclined to talk to our closest friends and family about something. And the problem, I think, lies where we talk to our friend and we realize that, hey, my friend needs help. Where do we go from there? Like, what's the next step? Dr. ATHRASH, what do you think? How can we support our friends or family who come to us and tell us, they've got a problem, and we feel ill-equipped because we're not trained, right? And we feel like, no, you need professional help. However, that's already a barricade that we need to jump over. What do you think can be done?
Yes, actually, what can be done actually? we need to talk a lot about mental health. We need to give awareness a lot to all the people. We need to go to school. We need to go to university. You need to go to some public sector. For example, we need to go to any ministry to talk to the penjawat awam to talk about this. Because why? A lot of people afraid to go to clinic because they said they're afraid to be called crazy. So we need to talk. We need to educate. We need to educate. Some people might have a different type of learning skills. So when they learn from us, so they can teach others. So, and also we need to be delete, or we need to report any of the social media that is spread awareness wrongly about mental health. Because I saw a lot in TikTok, they have a lot of mental health issue that is people promoting a different kind of idea. It's a terrible idea. Sometimes they talk about nonsense. They talk about their experience without even diagnosed. They are self-diagnosed a lot in the TikTok. So what I'm going to say, I agree with HETAL. The government should have more hiring, more inventing skills of people. We need to do some maybe course. We need to give inside the media, inside the TV. We need to have advertisement regarding this mental health, so that
right. So there definitely needs to be a lot more awareness going on in the country. Even though the situation is getting better, we are a lot more aware of it, but I think it needs to be an ongoing effort. Dr. ATHRASH, you've got a very, very interesting topic that you'd like to talk with us about, narcissistic personality disorder. Let's
where
hear
did that come from?
Why we talk about narcissistic personality disorder? Because 80% of men having this problem, compared to women, only 20%. So based on this DSM-5, they need to include this disorder inside this book. Not because we want to diagnose, I'm sorry to say, not because we want to diagnose a jerk. It's because we need to diagnose them because they problem with others. They make other people suffer. So based on DSM, we have 9 criteria. We need to have 5 out of 9 criteria. So what the number 1 is grandiosity. They feel that they are the biggest person in the world, and then they have preoccupied with fantasies of unlimited success, unlimited power, and then they believe that they are special and need to be treated or with people who have same ranking with them. And then they have require excessive admiration. They have self-entitlement, and then they have interpersonal exploitative. They have lack of empathy is very important. They have jealousy of others. They are arrogant, and a lot of people might say they have these symptoms, but actually, if you have this kind of symptoms, if it's excessive, it's burden others, you have problem with psychosocial, with interpersonal relationship, you might have narcissistic personality disorder. But unfortunately, HETAL and Pasha, people with narcissistic personality disorder, they won't come to the clinic for diagnosis because they are always CEO. They are big bosses. They are psychopath out there. Narcissistic personality disorder. Okay.
And that in itself, I think, is a symptom of narcissistic personality disorder. And I think we don't realize that, we might be living among them. I don't know if you've had any experience with...
Oh yeah, we're definitely living amongst them, definitely. What I really appreciate about what some progressive companies are doing, I love what Ashra has said earlier as well. They have a whistleblowing channel. So I remember a particular incident with a client that had a particular leader who was behaving in a very similar manner, not clinically diagnosed, but you can tell that he fits all of that criteria. And what happened was that the employees then created a Facebook page and wrote all kinds of comments about this person, and it blew up on media.
Right.
And then he or she was typically it's male, right? Whistleblowed, and then the company offered help to this person.
Right.
And so, yeah, I think it's critical because I love what was said, that you cause a ruckus to the people around you.
Yeah, and oftentimes these people actually don't realize that they are causing such a big how do I say it? Leave a path of destruction
Yes.
in their wake. All right,
Yeah.
Dr. ATHRASH, thank you for being with us today. And also, HETAL, we've come to the end of our show. There was just so much, too much for us to talk about, actually. We can continue this conversation
We can,
later.
a lifetime worth of
We
it.
can, indeed. Thank you for staying with us on The Nation this week. I'm Pasha Rahim, and we'll see you again next time.
Bye-bye.